Hello, and welcome to vlog number 2, Skills and Capacities in Speed and Agility Drills. The aim of this vlog is to identify what a skill deficit in both a sprint and agility drill would look like, as well as also identifying what a capacity deficit would look like in both a sprint and agility drill. I will also try to identify if it is possible that a sprint or a change of direction is impacted by both a skill and capacity deficit, and is therefore not exclusive to just one deficit. However, firstly, I will explain what a skill and a capacity is. A skill is a movement which can be learnt and can be practiced over and over again in order to achieve the perfect technical model. An example of a skill is running, jumping, and throwing or catching a ball. All of these skills, however, require a certain movement to be carried out in order to be performed in the best way possible. A capacity, on the other hand, refers to the structure and functions of the body, and how it can have an effect on the skill. Examples of this are someone's flexibility, mobility, their anatomy, and their ability to not only produce force, but also absorb force. We will now begin to look at athlete number 1. The focus here will be on a lack of skill in the start of the sprint. The athlete is a rower, and is therefore not exposed to sprints very often. Firstly, we will have a look at the start of his sprint in full speed. Then, we will slow it down and stop in some positions. We can instantly see that the athlete starts in a very casual and upright position. This is more evident when we slow down the video. We can also appreciate a lack of drive coming from the hip to drive the knee upwards. On the first frame shown, we can see a good amount of ankle dorsiflexion. This allows the athlete to push off and begin the sprint. This also shows a good level of ankle mobility, which is very important in sprinting. On the second frame, we can start to appreciate the lack of skill from the athlete in the start of the sprint. The red line shows the upright position taken by the athlete. This would slow down his acceleration phase drastically. Here, we can see the knee drive is not very powerful. The athlete does not drive very high, and fails to achieve full triple flexion on the early acceleration phase, as observed around the ankle joint. This could, however, be due to both capacity as well as skill issues, and therefore further examination would be needed. Therefore, we carried out some exercises such as A-skips and high knees without the use of his arms, which would emphasize the knee drive. This showed that hip mobility, although not perfect, was better than that which was shown in the start of the sprint. Therefore, this shows that the problem was due to a lack of skill more than a lack of capacity. To summarize athlete 1, here are some key points which could be focused on to improve the start of his sprint. In my opinion, he should strengthen his hip flexors to create a stronger knee drive. He should also strengthen his ankle joint, especially the anterior aspect. This would allow him to achieve triple flexion much easier. But most importantly, as a third point, I would just encourage him to keep working on the skill as a whole. Now, we will take a look at athlete 2. He plays football and is therefore accustomed to sprinting and accelerating. Looking at his start at full speed, it is difficult to identify many issues. However, when we slow down the video and take some frames from it, we can start to see how he moves closely. For example, here we can see that although there is a good degree of forward lean, there is still a lack of hip extension. This shows either a weakness in the spinal muscles or a lack of mobility in the lumbar spine. The skill, however, looks very good, and we can appreciate a good level of triple flexion at the start of the sprint. There is also a very good use of his arms to propel him forward. The only issue I can observe from the start of the sprint is the lower level of hip extension, as mentioned previously. However, the athlete does achieve a good level of plantar flexion at the ankle to push him off from the ground. Furthermore, some exercise will still be needed to carry out due to the fact that the athlete does not achieve a great stride. This could be due to a hamstring tightness issue. Therefore, the athlete was asked to carry out some A skips and B skips. Both these drills tested the athlete's coordination. However, the B skips also showed some hamstring tightness as the athlete does not achieve a full knee extension. He also struggles with the coordination in one of the steps. Both these issues show some capacity deficit as opposed to skill deficit. We will now take a look at athlete 2, perform some 45-degree agility drills. Firstly, we will have a look at the athlete carry out this short drill from the front. When looking at the athlete from the front, we can see that the athlete opens up slightly before making the step to the change of direction. At this moment, he is already leaning to his right. This places an unnecessary force on his ankle joint. On this second image, we can really notice how far he is leaning to his right, having almost all of his body over the center of mass. In a game scenario, he would be more likely to be pushed off the ball or pushed to the floor. This shows a great skill deficit. On the next image, he also seems to almost duck under the stick before changing direction, as opposed to staying upright and changing direction effectively. He is also not very close to the stick prior to changing direction. However, his body positioning seems to be better placed as opposed to the previous picture. Seeing it all in slow motion allows you to notice all these small skill issues which have been noted. Furthermore, we can have a look at athlete 2 carrying out the exercise from the back and from the side. From the side, we can see that the athlete uses a lot of the back of his foot to decelerate. This places a lot of force in the ankles and on the knees, which in turn could lead to an injury. He also leans back to decelerate, rather than leaning forward and reducing the stride length and making the turn quicker, once again increasing the risk of injury. Next, in this image, we can see how he crosses his body over his right knee, as this is his preferred position to push from. This not only slows the change of direction down, but also places a large amount of force on the ligaments of the knee, and therefore increases the risk of a serious injury. Therefore, it is important that this skill is practiced over and over again in order to achieve a perfect technical model. Lastly, we can see that the skill is not done appropriately, as there is a very large distance from the stick to the athlete once he is in stride once again. Ideally, the change of direction should be done as close to the stick as possible. We will now take a look at athlete number 3 carry out the same 45-degree agility drill. He is currently recovering from a hip injury which occurred in basketball. In this first video, we can see that the athlete struggles to change direction and carries out a few steps in order to achieve his aim. When slowing down the video, we can appreciate this much more. His first step, with his left, as shown in the first image, seems quite long, and he manages to fully extend his knee. Despite this not being the perfect technical model, it is important to note that it seems to be a coping mechanism in order to help the pain the athlete is feeling. On the second image, we can see him flexed at the hip and pushing off the left leg, which is where he feels pain from. I then got the athlete to carry out some drills in order to assess his range of movement. All of the drills seem to show a much lower mobility of the left hip as opposed to the right hip. This is shown in greater effect when the athlete carried out a 90-90 mobility drill. It is evident that the right knee can touch the floor, but when the athlete switches over to his left knee, he fails to achieve the same internal rotation of the hip, showing a clear capacity which will be worked on. In summary, it is clear that some overlapping between skill and capacity deficits do exist. It is important to correct both as soon as possible in order to maximize the effect of the drill and also reduce the risk of injury. Therefore, practice is very important, and mobility must also never be neglected. However, it is important to note that skills will normally take less time to correct as opposed to capacities. This is now the end of the vlog. Thank you for listening.